First of all, I want to thank everybody for just giving up their time to come and to learn, like we said, the fast facts about the Vacs. I want to first give you some background about what Being the Bridge is. Being the Bridge is a collective of young men who, well, not just young men, of men who started a group to empower each other. We were all feeling a certain type of way with all of the media coverage and the Black trauma that we're seeing in the media. And we wanted to establish a place where Black voices can be heard, where we can uplift each other, and where we could, as Devin Mosley has coined, educate, advocate, and elevate each other. So, like I said, it started out of a conversation, and this is our third torch talk. Our first torch talk, we talked about voting rights. Our second torch talk, we talked about Black identity. And our third one, which is now, we're going to talk about this vaccine and why some of our opinions about the vaccine. What I do want to say is that we are being joined by three phenomenal women. They're all innovators and creative in their own field. They're helping the community, and I am proud to call each and every one of them my friend. I'm going to give the floor to them. I'm going to give them a couple seconds just to kind of give you a little background so they can introduce themselves to the group. The first person I'm going to call on is Robin Menifee.
Okay, thank you, James. Good evening, everyone. My name, like James said, is Robin Menifee, and I am the Regional Director for Operations at the Palo Alto Medical Foundation ASCs. So that's a whole lot of stuff just to say that I am the operational leader over what is currently 6 ambulatory surgery centers, and we are currently building a 7th one. I know James through work. We work together. So I'm really, really happy to be here. I'm really excited that he asked me to come and be a part of this, and I'm really looking forward to meeting each and every one of you. Thank you, James.
Thank you. Thank you for giving up your time, Robin. The second person I would like to introduce is Jeanette Gray.
Good night, everyone. My name is Jeanette. A lot of people call me Jay, though, as we have another Jeanette where I work. I'm the quality coordinator for the 6 PANF ASCs, and I actually report to Robin. I know James through work. We work collaboratively together to do a lot of quality initiatives and work at the PANF ASCs. And I've been a nurse for longer than I care to admit to.
Well, welcome, Jay, Jeanette. And the third nurse that I would like to introduce is Miss Leticia Reed, Mrs.
I think so. Hello, everyone. I'm Leticia Reed. I'm a nurse practitioner, board certified in family and psychiatric medicine. DNP is there because I'm going to have it in a week. So I decided to put it up there so I can get used to it.
Can I stop you there? Can we all clap her up for that group?
That's right. That's right.
All need to clap her up.
That's huge.
Yes.
Huge. Congratulations.
So yeah, I'm excited to speak today too, because we have to do like a ton of hours for our doctorate to kind of do different things in the community. And I was like, oh, this is another great opportunity to do something where I can, like you said, be recorded, and maybe we can share this information and try to dispel some of the myths associated with vaccination. So thanks for inviting me.
Now I am going to just say a couple words. Although they are medical professionals, all the content and information that we are discussing tonight is for informational and educational purposes only. Although we strive to provide accurate and general information, the information presented here is not a substitute for any kind of professional advice. And you should only rely solely on the information. Always consult a professional in the area of your particular needs and circumstances prior to making any professional, legal, or medical decisions, okay? So I just wanted to say that Well, we made it. We have been trying to discuss what would be the best way to basically talk about COVID and this vaccine. So I guess my first question, I'm going to ask you, Mrs. Reed, do you feel that it's important to be vaccinated?
I do. And I mean, I do understand that everyone has personal choices and they have to make decisions based on their individual circumstances. But I do believe it's important to be vaccinated because generally what we're looking to do is protect the people around us. And so, you know, your elderly family members, maybe your own children, of course, yourself, the people in your household, you're looking to protect one another. And so, for example, in our household, it's 4 of us, but 2 of us can't be vaccinated, at least at this point. I have an 11-year-old and a 5-year-old. They can't be. So everything that we can do to protect ourselves, me and my husband, is we're creating a blanket protection in some senses around our children. So I think it's super important.
I'm going to ask that question again to each nurse just to kind of feel where they stand with the vaccination. Jeanette, would you, it feels really funny calling you Jeanette. I'm gonna have to say Jay. All right. Jay,
fair enough.
Do you feel it's important to be vaccinated?
So I am one of those people that have struggled with this because initially I was very hesitant about getting the vaccine. But as I followed the information and did my own research to make sure that I wasn't being sold a song and a dance, I realized that it is very safe, it is very effective. And as someone who has, I have asthma, so it's very easy for me to get any kind of respiratory illness. And as someone who did not want to mess with COVID or have that be a problem for me, especially as a nurse where I'm going to be exposed to it, dealing with patients, interacting with the community and the public, I felt it was in my best interest to get vaccinated once I educated myself and reassured myself to my comfort level.
Awesome. Thank you for that, Jay. Thank you. And Robin, do you feel it's important to be vaccinated?
Absolutely. For the same reasons as both ladies just spoke to, but also for me on a more personal level. I live and work in California currently, but I'm from the East Coast, from New York, and a lot of, I think everybody saw the news and how terrible it was in New York. So, you know, I felt like my heart was in my throat every day, just worried about my brother who was continuing to work and people coming around, my family members. So for me, on a much more personal level, you know, we saw several people that we literally went to school with, my brother and I, passed away from the effects of COVID. And some of our friends' parents did. So it hit me in a different way, I think. I don't know what everybody's personal story is, but for me, it was really personal. So I was very excited about the vaccination because I think it was really important for people to be able to build those immunities and be able to, you know, be somewhere within the vector or the area of this disease and be able to fight it, you know, to live through it. Like, too many people were dropping fast. So I thought it was really important. And I really wanted to see, you know, all people, but specifically people of color, get out there and get protected. So definitely.
That's awesome. So what we have done is I have asked some of the members of the group just to ask their family of some questions that they might have about this vaccine. So what I will do is I will go through those questions. I will ask to the panel. You could just raise your hand, panelists, when you would like to answer the question. And at the end of this, if you had another question that was not answered, we ask that you write it in the chat. If a panelist feels that they have that information, they will go ahead and answer it. And if not, we'll get back to you. What I want to say is that this COVID-19, even though we've been talking about it for a year, we're learning things about COVID-19 every day. And the best modalities are the best ways to handle it and how it's affecting us. So the nurses will answer the questions on the knowledge that they have, what they have, on the education that they've gotten. So we ask that you have an open mind, like I said before. If you have something that's particular to you, you want to make sure that you're addressing that with your physician. But like I said, these are just some fast facts. These are some frequently asked questions that we've got from some of the men, and that we're just going to answer. Okay, I'm going to go ahead and admit that one person. So the first one I got, I'm just going to go straight down the line. So the answers might seem a little bit out of sequence, but I'm going to ask the questions as I presented it to the panelists. Should the mRNA approach taken by Pfizer and Moderna be used to protect the Earth against other terminal illnesses? How can I speak?
I guess I will start. So there are a lot of different ways to make a vaccine, but the ultimate goal of any shot introduced into the body is to create the biological equivalent of a most wanted poster, so that the body can recognize something that is not supposed to be there and fight it off. For some vaccines, that's like a weakened version of the virus, like most flu shots, maybe the chickenpox vaccine. But this is much different. This one takes a different approach. So what it's doing is it's using the beauty of our own biology to deliver protection. Basically, what it does is it teaches the body to remember the coronavirus's defining features, like the spike protein, to prompt creation of antibodies that can prevent it from infecting the cells. So this is a replicable process, and they are now looking at attacking and approaching other illnesses the same way. And I don't know if a lot of you guys saw, but a couple of weeks ago, there was notices that came up over Twitter and other social media about how they were using this process to approach treating HIV. So there's a lot of stunning breakthroughs that this virus work and vaccine work has opened up for other illnesses. It's not a definitive answer to all of our future illnesses and problems, but it has definitely opened and paved the way for new medical breakthroughs.
She's a rock star, isn't she, y'all?
I'm attached to Jay. I think that was such an amazing answer. But also I want to add on too, I mean, alongside what she said, I think that you have to consider the fact that there's so many different types of terminal illnesses. And so I think you kind of have to hone in on what you're talking about. Specifically, this is a virus, as just as HIV is. So it seems like it would be far more applicable to that one than it would be, for example, like maybe cancer or tumors, that kind of thing. There's a ton of different types of terminal illness. And then there's also chronic illness that leads to terminal illness once it's been uncared for. So I think it depends on which focus you're looking at, which types of illnesses, which types of diseases. But I definitely think in reference to viruses, like she mentioned, it could be a huge step in the right direction. So.
Awesome. What's the likelihood we will need a booster shot if you have received the vaccine first? What is the likelihood you will need a booster shot?
Okay, so I'll answer that one. Very likely. There's been some information out there in the news recently about the fact that right around 9 months or so, the inoculation starts to kind of wear off. And by the time you get to the 12th month, you really don't have any more immunity. So it'll start to look something like the flu shot. So, you do the initial 2 shots to get your initial inoculation. And then after that, every 12 months, you'll be expected to go back and get a booster. So it'll feel like the annual flu shot.
Thank you. Does the vaccine affect and work differently in various age groups?
At this point, they don't have any evidence that it does. They did in the very beginning during the screening process ask about different types of chronic illness. They wanted to know if you had diabetes or heart problems, respiratory issues. And I think in the beginning they were doing that mostly because they wanted to collect data to make sure that it didn't. and they found that it doesn't look like it affects any groups any differently. Now, in reference to age group specifically, you have to keep in mind that we don't really have anything for 12 and below yet, or 11 and below yet, but for 12 and up, it looks like it affects all those groups exactly the same. Did I answer the whole question?
Oh, no. Actually, yeah, there was a second part to that question. Does the vaccine affect people with common medical diseases differently? Diabetes, COPD, heart problems, and respiratory issues?
Oh yeah, so I kind of touched on that, but I want to actually even add to that. Those groups actually are the ones that are highest priority in so many ways, because they are the ones that are more likely to have the most severe illness if they were to actually get COVID. So in reality, it's not going to affect them differently, but they're the highest risk. So they're actually some of the highest priority patients that we have.
Thank you. I know a lot of us are worried about cost or insurance. So is the vaccine free? And where can people get vaccinated?
So I'll take a shot at that one. The vaccine is free for everyone. The federal government is currently footing the bill for all of those who live in the United States. And for pretty good reason. They are trying their best to make sure that they can get a herd immunity going. And they don't want any barriers such as I can't afford it to keep putting people at risk. So everyone 16 years of age or older is eligible for the vaccine. And the easiest way to get access to the vaccine, there's a couple options. There's vaccinefinder.org. There's the CDC website that hooks you up with a lot of different links on how to get access to the vaccine. You can check with your local pharmacy, CVS, Rite Aid. A lot of them are already participating in the vaccine programs. You can check with your local state health department, and you can also check with your local news outlets. A lot of them have that information right there on their websites. And if you contact them, they will be happy to help you find a spot.
Awesome. Awesome. Does the vaccine exacerbate mental illnesses?
I'll take that one. No, it's very similar to some of the other chronic illnesses, diabetes, hypertension, high cholesterol, all those different things. You're definitely going to be a prioritized patient. No, it does not exacerbate at all, but it's going to protect you in so many senses. I mean, imagine someone that has mental illness, delirium, delusional behavior, those types of things. It's going to put you in a better situation, because if you were to make poor choices, you would likely be more protected with the vaccination itself.
Awesome. How does the vaccine interact with people who take a lot of medication?
So far, I'll take that one. So far, there's really no information out there that speaks to it having any type of a negative interaction with anybody who's on medication. So older people, people with comorbidities, there's been no information out there to say that, getting the vaccination will somehow negatively impact, the medication that you're on, or impact your life negatively because you're on medication.
And to piggyback on that answer, you might be like, well, how do you know that for sure? Well, it also comes down to the fact that most medications are taken for maintenance of different medical issues, and COVID-19 vaccines approach from a completely different system, your immune system. So the medications work on a whole different process, and they're two different processes that don't really interact.
The only thing that they have mentioned, though, is that if you've had another vaccination, they like to know. They need to double check and cross-reference any other vaccinations that you might have had recently. So I think that they're asking if you've had a vaccination within the last 2 weeks. I know for sure hepatitis is one of them, and there may be a couple of other ones. I don't know all the details about those. But if you've had another vaccination, you should definitely wait until and speak to your medical provider before you get any type of COVID-19 vaccination.
I just want to say that you guys are amazing. Like you guys are amazing. We've been asking these questions, and you have been prepared. And just look, y'all, look, this is our community talking to us, right? That's powerful. I for all the students here, that is powerful. What are some potential allergens in the vaccine? Did I ask that question right? Let me say it again. What potential allergens are in the vaccine?
So I'll take a whack at that one too. PEG, which is polyethylene glycol, is an ingredient in the mRNA vaccines, and polysorbate is in the Johnson & Johnson / Janssen vaccine. So if you're allergic to those two materials, then you should probably seek expert consult from your primary care provider prior to looking into the vaccines.
Thank you. Is it safe for pregnant women to get the vaccine?
They actually just published some data, like I think within the last 2 days, stating that it looks like pregnant women are perfectly good candidates for the vaccination. And they're actually in that higher risk group because when you're pregnant, you're carrying a child, you tend to be far more susceptible to the COVID-19 virus. So you're actually on the higher list with the patients with diabetes, hypertension, all those other groups. It's considered safe at this point. In the beginning, they didn't have that data, but they just concluded that. I think the CDC, FDA put that out about 2 days ago.
Thank you. Will infants and toddlers be able to get the vaccine? Will infants and toddlers be able to be vaccinated?
So children's immune systems are very different from adults. And there's not a lot of data on how the vaccine response works currently in children. And their immune responses can be so different between infancy through the teenage years. So the research has been done for ages 16 and up, and there's a lot of solid data about that. Both Moderna, Pfizer, Johnson & Johnson have started to look at how the vaccine affects toddlers through young teens, but there's not a lot of data there. But they're about to start trials. So for now, it is not recommended for children, infants, or toddlers to be vaccinated.
And just to piggyback onto Jay, it looks like they're hoping, well, like you said, they're doing a lot of research right now with some of the younger kids. And it seems like they're focusing right now on 12 to 16 or 12 to 15, I should say. And so if any group was going to be next, it's going to likely be that group. And I think they're going to end up just really working their way down. Because, I mean, in reality, who really wants to do a research trial on their infant? Like, no one wants to do that. I have a 5-year-old and I'm not interested, to be very honest.
Absolutely. Absolutely.
Don't have a vaccine.
Plus, at those ages, you're able to manage and manipulate what they're exposed to. Infants and toddlers aren't running out and cavorting in public with John Q. Public.
Great point, Jay. Like, yeah, these kids will stay in this house if they have to. No.
Exactly.
That's what we got a backyard for. Go play.
Yes, that's what backyards are for indeed.
Yeah.
Yes, ma'am. Yes, ma'am. We know that there's different vaccines. We have Moderna, Pfizer, and Johnson & Johnson. Are some vaccines better than other vaccines?
So it's really hard to tell because they weren't directly compared in the studies. And experts tend to say that the vaccines are alike on what matters most, preventing hospitalizations and deaths. So as long as they continue to protect us from severe disease and reduce our possibility of getting COVID, it really doesn't matter. And that's probably not going to be data that's going to be prevalent or available anytime soon, as that's not the focus that people are looking into at this point. And the real world evidence shows that so far millions of people have gotten all the various versions of the vaccines, and for the most part, they're working really well.
Well, let's address the white elephant too, Jay. Let's just do it, right?
All right, let's call it out.
Do it. Okay, so everyone is terrified of Johnson & Johnson now, right?
Mhm.
Like, wait, 6 people at it, 7 million? Oh, heck no, you know? So yeah, I definitely think that I understand the reservations around it. It looks like there was a group of women between the ages of 18 and 48 that developed the blood clot, and one of them passed away due to the blood clot. I can understand reservations around that, but it was very specific to a specific group of women. I mean, a specific population, 18 to 48 women. And we just don't have a lot of the information yet. They haven't shared a lot of the details yet around what they think might have been the link between those women. It could have been some sort of other chronic illness. It could have been, we don't know if they were pregnant. We have no clue what was going on with those women. So I do understand. And I'm not going to say that, oh, you should just trust whatever people say. That's not what I'm here to say. I do want to say that you have to make the best choice for yourself. So if you feel more comfortable with Moderna or Pfizer, you should go that route. If that's what makes you feel more comfortable after speaking with, your healthcare provider and getting that guidance, I can definitely see that. But yeah, it looks like that was very, very, a very special small group. I mean, 6 out of 6 million, you'd hate to say that, that's pretty good odds considering that one person passed away, but I would have to say that it was pretty good odds.
That being said, out of an abundance of caution, they've taken Johnson & Johnson vaccine off the availability list currently as they're revising and relooking at the data. So as of April 13th, it's not even available to the public. So right now in the United States, you can only get the Pfizer and Moderna vaccine.
But no, they're still giving it in Europe, actually. They decided that they're okay with the risk and they're still giving Johnson & Johnson in most parts of Europe.
Right, just in the States though, you can only get Pfizer and Moderna. Yeah.
And then there's AstraZeneca also in the EU, and I'm not sure when that's going to come. I don't know as much information about that one, but that's going to eventually be a fourth option.
All right. How long will the vaccinations last?
So the vaccines we have right now are the 2-dose vaccines. And after the first dose, we're seeing a really good response. And then the second dose really kicks your immunity, it boosts it, kicks it in with about 2 weeks. And then its efficacy is between 6 to 9 months. And that's what the data we have right now. All the facts point to, as we said earlier, that this will end up being kind of an annual vaccine that you'll need to get. There isn't data that's really strong that speaks to or supports that the vaccine lasts longer than a year currently.
Right. Does the vaccine cause people to become sterile?
No.
That's a great question. That's a great question.
So, I mean, I don't know.
Take that one?
I mean, I can take it, but I think my answer is just no. They don't have any evidence supporting that. They've done a lot of research, and based on what they've done so far, and they've worked with all populations of people, especially women of childbearing age, and there's been no evidence to state that that you would become sterile. As a matter of fact, like we mentioned earlier, they're actually offering and suggesting that women that are pregnant are also getting the vaccination. So it appears to be safe for women that are of childbearing age and also that are pregnant, at present. So.
And to piggyback on that, as this is predominantly a men's group, I believe, there's evidence that show that getting COVID-19 as a male can lead to sterility. So actually getting the vaccine can help prevent you from going sterile.
I forgot. That's a good point.
There's your little split the switch.
Y'all hear that?
That is very true.
My last 2 questions on this rapid fire, and I want to again thank you for just we've been throwing these balls at you and you've been knocking them out of the park. So we just want to thank you. The first one would be, how can you know it's safe how can you know that these vaccines are safe since they were developed so quickly?
That's my favorite.
That's your favorite question? Well, come on, girl. Knock it out the park. Let's see.
I don't know if I'm going to knock it out the park, but it is my favorite question. Jay's probably going to have to help me out with this one. But I definitely believe that people are under the impression that it was developed quickly. In reality, it wasn't. The interesting part is that coronavirus of some sort, there's different strands of them, and they've been around for a long time. People have actually been studying coronavirus for over 50 years, or at least 50 years, I should say. And so when SARS came out, I think it was in 2002 or 2012, one or the other, they started doing studies on vaccinations back then because they actually assumed that SARS would turn into this. And so it actually did, and it kind of died down and it went away. But in that time, they actually created a vaccination for SARS. And so they were able to really piggyback a lot on what they had already studied and what they'd already learned. And they just kind of had to look at the different protein variations that were a part of this actual virus instead. So they're able to make some small adjustments. And then once they had a population to test on, it only took maybe 9 or 10 months to do it after that. But it's because they already had so much evidence before that. They had so much that they were able to build on. And so, I mean, similar to HIV, maybe someone would say, oh, now all of a sudden they have the HIV vaccination, when they, they just had that, when now they don't. But I mean, in reality, like she mentioned earlier, I mean, already piggybacking off of this mRNA sequence and the way they were able to eradicate your exposure to the illness this way, they could do the same thing with HIV. So I think it's not so fast. It's just that they had a lot of data already.
You nailed it. Basically, that's what I was going to say. And I do find this as one of the most interesting questions. The other thing I'd like to add is the CDC and their partners who they continue to monitor the response to the vaccine and adjust it as needed. For instance, with Johnson & Johnson, I mean, 6 people and they shut it down. So this is the most intensely monitored vaccine that has ever been produced because everyone's eyes is on what's going on. Is this working? Is this a danger to us? Are we being fed a story from the government? So it is intensely monitored. It is adjusted as needed. And as she said, there's a lot of data that's already gone into this, and they just had to tweak a few things, adjust a few things, and have something to test. And they tested it all last year while we were on lockdown.
The last question I have for you is question 20. It's, when will the vaccine be open for everyone?
I think we're either there in some counties or almost there in most counties. Generally speaking, what do you know? What's going on up there, Jay? I think down here, people are 16 and older are able to get it depending on their circumstances. And I think most of the high risk groups have already gotten their vaccination, at least their first one. So
I believe
they started with the high risk and then they've moved it down. So right now it is open to everyone who is 16 years of age and older.
Right.
All right.
Wait, James, before we stop though, I want to address one more white elephant. And Jay and Robin can help me with this one. I think it's important to address the fact that, I understand why people of color have issues with these vaccinations or any type of healthcare treatment that's being offered to us. You're not insane or you're not being ridiculous. I mean, I get it. And I understand that it stems from a long history of systemic racism and inequalities in medical treatment and care. We've been test rabbits and bunnies and all kinds of other things in so many situations. This is not that. In my heart, I don't believe this is what that is. We are all using the same vaccination and they're trying to create a herd immunity amongst all of us as a nation so that we can get back to living normally, as normal as we can. But I do understand and recognize that we've had a lot of disparities in the past, and there's good reason for you to research and study and make sure you understand how this is going to work for you and your family. You have the right to do that because you have a right to have some small amount of distrust.
Absolutely.
As Dr. Simmons gave the snap. So we did have some questions that came in through the chat. I don't know if, what I will do is we will look at these questions because as you see, every question that we asked today, there was a bit of research that needed to go into that. So we will look at these questions. I'm not sure if any of the panelists feel comfortable looking at any of these questions.
What I'll do is I'm gonna put I'm gonna copy and paste all of them.
Okay.
And if there's any questions that you feel like you could address, go for it. For those that we can't, for the students in the room, what will happen is Brother James will get this to the doctors or whoever. I'm not quite sure who you're gonna ask, but I'll get these answers to you. That's all that matters.
All right. So can you all get off of mute? And can we give a big round of applause to these 3 queens that have came to speak to us and right? Thank you. Like my heart is truly full. This group started because we wanted to make sure that we were giving information out to us. to those who looked like us. And I think we're continuing to do that. And we really want to thank you for giving up your time, for taking the time to research these questions and giving this knowledge or passing this knowledge on to some of the students in the group and some of the members of the group. We cannot thank you enough. Like Brother Blaine said, he's going to go ahead and copy those questions. So if you wanted a moment, if you had a question that was not answered, you can go ahead and post that into the chat so we can copy and paste that and we can get back to you. Blaine, what is our email address, our contact information?
So it's going to be We the Bridge. I'll put it in the chat box as well.
Just really quick though, I think I can answer number 6 and number 3.
Okay.
And I'll let the other ladies decide if they can answer the other ones. I'm not sure about the other questions. But number 3, if you're currently on chemo, yes, it's safe for you to get the vaccination. I don't have the data supporting it. I can send it to you guys later on so you can have some evidence supporting it if you want, but it is definitely safe to get that vaccination with chemo. You're actually in a high risk group. And then number 6, in reference to providing which one provides better protection, it's going to be the vaccination actually, because if you've already had COVID-19, you're still recommended to get the vaccination.
This might be a silly question, but if you are vaccinated, well, no, it's not a silly question. My question is, if you are vaccinated, can you still, you know what, I'll put my question into the chat. Don't worry about it. I have to think about how I'm gonna ask that question. But again, I would like to thank everyone for coming out and listening. I do want, again, I want to thank the panelists for giving up their time and answering the questions. You are a light. And without, I know that I looked at a quote the other day and it was like, what is activism without action, right? So if we want to heal our community and do stuff like this with our community, it causes action. So I applaud the brothers who came up with this idea and helped me develop this. So I will give you the gift of time, and I want to say thank you all for coming.
Oh, James, there was a couple questions that came up that I feel comfortable answering.
Let's go.
If anyone wants to hear that. There was a question, I believe, that said, what are some of the side effects of the vaccine? So where you get the shot on your arm, the most common side effects are pain, redness, and swelling to the area. And you would treat it just like a flu shot. You could put ice on it. They suggest that you use it, exercising, get the blood flow moving to help reduce the swelling. Throughout the rest of your body, some of the common side effects are tiredness, headache, muscle pain, chills, fever, nausea. It's kind of like mild flu symptoms, and those should dissipate instead of getting worse. If you start feeling worse after getting the vaccine and you start feeling these symptoms and you start to get worse, you should really see a physician or your primary care provider. Someone asked earlier, what's in the different vaccines? So the Pfizer vaccine is made up of mRNA, which is a messenger ribonucleic acid. And that's the only active ingredient in the Pfizer vaccine. It contains the molecules needed to make genetic material that provides instructions for your body on how to make viral protein that triggered an immune response. It's also got lipids, and that's its purpose is to kind of protect the mRNA. It's got salts, sugars, and I believe that's it for the Pfizer. For the Moderna, it also has mRNA. It has lipids. It has some acids like acetic acid, which is pretty much like vitamin C acid, acidic stabilizers, some salts, some sugars, And then in the Johnson & Johnson, it's got a different makeup. It's got recombinant replication incompetent adenovirus type expressing the SARS-CoV-2 spike protein. So it's not based on the mRNA at all. It's based on a different protein sequence that's been modified to be kind of like a harmless version of the virus. And then it's got acids, citric acid, salts, trisodium citrate, sugars, some other ingredients, and ethanol. So it's all kind of similar ingredients. There's nothing super surprising in any of the vaccines. Of course, there's a proprietary blend for each of them. They're not going to tell all their secrets, but it's very simple, the combinations of what's in it. That's it. That's it for me.
All right.
So if I can chime in real quick, if there's no other questions that you guys feel comfortable answering, was there? I didn't want to cut anyone off out of the questions that were posted. One thing I will say, I want to thank, James already said it as good as we can. Thank you guys for being here. This was awesome. I know students are going to benefit from this. We recorded this. I had a lot of students that had conflicts who might have had to work or have family that they have to tend to. So I'll definitely be sharing that with them. For the women on the call, I have many students, including Jasmine here, JJ, that's listed, who are students who want to get into the healthcare field. Would you be comfortable, being open to, maybe meeting with some of these students, kind of talking about your experience, how, advice for them? These are all community college students who really want to get into, different fields, and, some want to be doctors, some want to be nurses, you name it. Is that something you might, I don't want to put you on the spot, but is that something you might be seeing yourself able to do?
Absolutely not. No, I'm just kidding. Yeah, of course. Of course.
Sounds good. So, Jasmine, I'll make sure I get all of their contact info, and then maybe we could set something up with all of our Umoja students who are down. For those of you who don't know, Umoja is a program in community colleges designed to really improve Black outcomes in the community colleges. So that's who they're all here. I appreciate all of you guys for coming, for educating yourself. Ultimately the choice is yours on whether you're getting vaccinated, but at least you have more tools now to make that decision. So I appreciate all of you guys for jumping in, and I'll definitely make sure to link you up with these awesome queens in here. It's been awesome. It's been dope.
Yay.
All right. Well, you guys, thank you for coming, and have a good night.